October is Breast Cancer Awareness Month. It is a crucial time to educate ourselves and our loved ones.
Breast cancer is the second most commonly diagnosed cancer in women in the U.S. In fact, listen to this. 1 in 8 women will be diagnosed with breast cancer this year alone.
And joining us this morning to help raise awareness is Stanford OB-GYN Leah Millheiser. Leah, thank you so much for taking the time to come in this morning.
Thank you for having me.
So we obviously know the research and the data when it comes to getting a mammogram, screening, etc. But I want to know, for me at 43 years old, Gianna, any of our viewers at home, what can you do starting today when it comes to your overall health, if it be diet, working out, etc., to help prevent?
Yeah, so we really think about what the risk factors are. And for women who are in their 40s, mid-40s to early 50s, number one, it's about screening. So there's a lot of controversy around when should I start screening? Do I start at 40? Do I start at 45 or later? So there's no consensus on when to start screening. However, most organizations will say start at age 40. Some will say start at age 45. The reason there's some issue around that is because 45 and younger, we don't see a lot of breast cancer. And if you get a mammogram early, the false positive rate is higher. However, because we know people have certain risk factors, we say start somewhere between 40 and 50 every 1 to 2 years and typically continue that until about age 75.
Something we've seen in the news lately when it comes to screening is the density of your breast tissue and how sometimes if it's more dense, you can't really see anything or as easily with a mammogram to detect cancer. First of all, how do you find out if that's how your breast is, if you have dense tissue? And then what do you do from there to make sure you're getting checked properly?
Right. So most of us, when we're premenopausal, meaning before menopause, we tend to have more dense breast tissue that's replaced by fatty tissue once we go through menopause. The amount of dense breast tissue you have varies. So we know that fibrous and glandular tissue makes the breast feel more dense. That can make screening a little bit more difficult. So oftentimes women will be called back to have a secondary screening. So you may get a mammogram and then get that call back to come in for ultrasound. So we do see that happening more often in younger women. However, if you do have dense breast tissue, just be aware that that is a marker. It's a risk factor for breast cancer. So we want to make sure that those women, instead of maybe getting a mammogram every 2 years, you want to get it every year.
I had the opportunity to sit in a diagnosis room when somebody close to me was receiving the diagnosis for breast cancer, and they laid out her treatment plan. And that's when you really realize that what you see on TV, these conversations that we have during Breast Cancer Awareness Month, they are real. This affects the entire family. And my question for you is, how as a man can I be supportive to the women in my life to make sure that they know this is important and I'm right there behind you?
That's right. So whether or not you are a caregiver, you're a spouse, you're a partner, you're a friend, obviously emotional support is the most important thing that you can do. Being there for a friend, being there to deliver food when needed to the family. When a woman is going through acute treatment, meaning chemotherapy, maybe she's had surgery, maybe she's going through radiation, there's fatigue, there's exhaustion, there's feeling unwell. So having the support is really, really important. We do know in relationships, this is actually probably the most important thing I can say, is that in relationships, sometimes there can be a little bit of difficulty during that treatment phase. So we know that we've heard cancer brings couples together. Sometimes it doesn't. And so I tell people early and often, if there are some issues in the relationship, and I'm talking about with your primary partner, please get some counseling around that because there's potential for it to get worse. And that's something that really helps a lot of people because everybody reacts to their treatment differently, emotionally, physically. Right. So making sure you have emotional support, whether it's from a friend or a therapist, having those people rally around you is probably the best thing that you can do.
That is such a great piece of advice because oftentimes you don't think about that emotional and mental toll that it takes from diagnosis to journey. Thank you, Dr. Leah Millheiser, for joining us this morning.